Sorry, everyone. We're going live now. Welcome.
Hey, Pat.
Yes,
Bob had asked me to handle the meeting minute, and I guess you're handling the president's report, right? Because he's going to be gone.
I was handling the meeting.
Oh, yeah. Okay, that's wonderful. No, that's great.
Okay, what it really doesn't matter.
No, go ahead and do it. That way you got the whole thing. No
Okay.
problem.
Okay, yeah, I thought well, Sandra and I both thought that's what I was doing.
Okay, good.
Oh, is that okay? All
That's
right.
fine. That's fine.
Okie dokie. All right.
Erase all messages. Press erase again. No message.
David, your meeting is on.
Okay, and I think
David, your meeting is on.
okay.
Sandra, with the confusion of all the schools and the whole mask issue, IHSA issued a ruling or sent an email out to their referees. If they referee at a school that has relaxed and don't require the mask, they don't have to wear a mask as a referee. If they referee at a school that does, then they have to wear a mask. But they still have to have, even if the school doesn't wear the mask, they still have to have this mask timeout every quarter.
Well, but indoor mask mandate is still in place.
Yeah. But the schools aren't, some of the schools are not doing them, I know.
It's confusing, isn't it?
It's very confusing.
It is. I think for a lot of people, it's confusing
Yeah.
right now because one piece is the governor's mandate and one piece
Yeah.
is something coming out of the courts.
Yeah. If in doubt, wear a mask.
Well,
Then you know
so.
that you're okay. Then you know that you're right no matter what you did.
Yeah, I guess so. Okay, it looks like it's 6:29. I'm looking to see how many people we've got a quorum. Angie, can you hear us?
Yes, I can hear you.
Okay, good.
It sounds like you can hear me. How about that?
Yeah, yes. Always good.
You got 8.
Yep.
Yeah. And it looked, a second ago, it looked like I could see Jennifer, but now I can't.
Yeah.
She is having some internet issues, so
Right.
she might be coming in and out.
Be coming back and forth. So it is my understanding that we have to take roll call votes for everything that we do. Because Jennifer is in and out of connection, and so even for our agenda, we'll just practice and we'll take a roll call vote. So let's call the meeting to order. We have a quorum. And the first item on, let's see, I don't see any guests.
No guests.
No public participation. Okay. And we need a motion to approve the agenda.
Moved.
Don't move.
Second.
Okay, are there any additions or corrections to the agenda? No, okay, hearing none. We will do a roll call vote to approve the agenda. So let's start with, I know, I'd say we should do it the way it pictures, but I don't think everybody has the same picture.
Why don't you do it the way it shows on the agenda?
Yeah, Christina will call it for you.
Oh,
Oh,
okay.
thank you.
That's better.
Yeah,
Is
that's not a
perfect.
problem. Okay, roll call vote for approval of agenda for February 15th. Ron Gottschalk,
Aye.
Angie Gorel,
Here.
Dr. Halverson, Dr. Helen,
Aye.
Lucy Hoover,
Aye.
Dr. Lewis,
Aye.
James Powers,
Aye.
Dr. Williams,
Aye.
Robert McCreath, Alderman Torina, and Jennifer Maraska.
Aye.
Thank you.
Miss John.
Did we miss John Halverson?
Yeah.
He just came on when you were
He
doing the
just
list.
came on.
Okay. John, how do you vote on the approval of the agenda?
Oh, I'm sorry. In favor. Aye.
Okay,
Thank you.
thank you.
Thank you.
So the motion carries and we can move on. The next item on the agenda is the approval of the minutes of January 18th. Is there a motion to approve?
So moved.
Second.
Okay. Are there any additions or corrections to the minutes that were presented in your packet?
And I'll take a roll call vote. Ron Gottschalk,
Aye.
Angie Gorel,
Yes.
Dr. Halverson,
Aye.
Dr. Helen,
Aye.
Lucy Hoover,
Aye.
Dr. Lewis.
Aye.
James Powers,
Aye.
Dr. Williams,
Aye.
Robert McCreath, Alderman Torina, and Jennifer Maraski.
Aye.
Thank you.
Okay. So the minutes are approved and we can move on to the presentations for this month. And we have beginning the presentations with the annual report.
Okay, great. I'm gonna go ahead and share my screen. Oh, sorry. This is the 2021 annual report. So last month we talked on the 2020 annual report, which was mainly on COVID prevention. And in the 2021 annual report, we're focused mainly on the vaccination efforts was a big part of that, as well as another potential public health crisis that came up with the fire that burned in Rockton at the Chem Tool facility, the Rockton fire, we'll refer to that as. And so this report focuses a lot on the vaccination efforts with COVID-19 response and with a little bit of the Rockton Chem Tool fire too. So this focuses on how in 2021 we entered the year with a surge in COVID-19 cases, and we had a vaccine that was becoming available, and throughout the year eligibility expanded with that vaccine to cover all those 5 and older. But by the end of the year, we still had over 50,000 cases in COVID-19 with 638 deaths, and we still had a vaccination rate of only 54.6%, and we began to see a surge of cases again. In COVID-19. We continue to be in incident command throughout the response with support from our EOC. Vaccine supply, we had a lot to deal with logistically with the vaccines of just, managing the storage, the handling and distribution. We had a lot of messaging that had to get out to try to get information out into the community about the fact that there was vaccine available. So we did that with a Vax Up 815 campaign with billboards and a raft bus that was mobile and went to the different, into the community to different sites. We also, at the vaccine site that was set up at the community-based vaccine site through Sandy Hollow and Mount Zion, we had over 80,000 vaccinations given at those standing locations. We also continue to work with our COCs to get information out into the communities of concern, to the vaccination areas, to the neighborhoods that were most impacted by COVID and had low vaccination rates as well. We also worked with our young adult populations in the community to try to incentivize vaccinations. And while all this was going on and ChemTool was going on with the Rockton fire response, we worked with the IDPH and the EPA to monitor the air and water. We also worked with the CDC and IDPH to put out the health impact survey, which then those results were shared with the public. That was all regarding the Rockton fire. And while you had 2 emergency responses, we also were working on some routine public health services to residents. We had to maintain those. In addition, we completed the I-Plan 2023. So that was completed at the end of 2021 as well. So there was a lot going on in 2021. Just a quick overview of some of the points. We have our monitor health, focusing mainly just again on COVID, that we had an increase of cases in the at the end of December, and kind of the information we talked about before, and then just that we had also saw an increase in syphilis. So we're messaging on that. In our diagnosis and investigate, we focused on the fact that we were trying to maintain as a priority, trying to maintain in-person learning in schools. We focused on isolation and quarantine, and that there was this option for children that were quarantined to be able to test to stay, to try to stay in in-person learning. We also had with the Rockton fire, we worked as part of that process, again, on the health impact survey to be able to utilize the information to try to get that survey out to multiple residents who may have been impacted in that zone. And we used the Qualtrics system to do that, which we'll talk about again in a little bit. In the inform and educate, we did a lot of different information campaigns around the vaccination with the Vax Up 815. We had billboards, we had bus ads, we had business cards that we were able to put in the different businesses in the communities of concern as well. We had a referral program that was trying to encourage residents to help their neighbors, friends, and family get in and get their vaccination. We had we expanded our digital media footprint. We added a TikTok account, which, if you guys recall, is a short video clip social media application that's larger, more utilized by a younger population than the Facebook, which is kind of more geared towards a lot of the 40-year-olds kind of use that Facebook. And so we tried to expand that with some videos. And let's see, and we worked on, in the Rockton response, Dr. Mattel did many news conferences both on COVID-19 response and the the Rockton fire response. And in the Rockton fire response, we also put together a guide with IDPH and the state agencies to help provide information on how to return safely to homes within the 1 mile evacuation zone. We engaged in the community to try to continue to encourage vaccination. So with the COC, we continue to do outreach to the communities to register. We did register now, decide later, when we were registering for a vaccine before it was just widely available. So that was when you had to register and then make an appointment. We also did the Vax Up bus. It was walk up. So we had the walk up available at that bus that went into the neighborhoods, and in the neighborhoods that it went in that had low vaccination rates, we also did door-to-door outreach to provide information that the bus was there, that was going to be there, and try to get people access to the vaccine in that way. Through our young adult population, they encouraged us to do a food, music, and shots event, which provided food vouchers and live music to try to encourage young adults to come get vaccinated. They did videos with the young dancers with Vax Up facts that we issued out through that TikTok account. We did giveaways, like the shirts and other giveaways were given out on trying to put the bus at locations that young adults might go to. So those are some of the pictures from the outreach. For policy and plans, the iPlan 2023 was completed, and that identified the 3 health priorities, which are continuing from the last iPlan, as well as maternal and child health, mental health, and violence prevention. So those are the 3 health priorities that were identified during the 2023 iPlan. They happen to be the same, but so that just helps us to remember. We also had different policies that were created last year. One was on telecommuting for remote work, one on COVID-19 mitigation policies, and the vaccination policy, which I know you're all familiar with. That's come to the board a few times, those policies. So those were developed. We also have the legislation was changing for the cottage food legislation, which is the legislation that allows people to bring from a home kitchen that isn't regulated by public health authority to market, bring the food from your home to market. It does require registration with the local health department. That is new legislation that has gone out. So we were working on being proactive about identifying the guidance for that. And we have information up on the website, but we're not pushing that out as there's a lot of developments that are happening with that. So we're watching closely on that guidance. The laws in public health, mainly there were executive orders issued to help with public health guidance. So for example, as we were just talking about earlier, the August 4th, when the governor put the school mask mandate on August 30th, he put a statewide mask mandate to go along with the school mask mandate. IDPH issued emergency rules that amended the Control of Communicable Disease Code, and that rule required schools to investigate and identify close contacts and exclude confirmed and probable cases, as well as close contacts when they were. That might help clarify some of that for some, I'm not sure. And then the link to provide care. So this, we always want to make sure that we're providing access. So Qualtrics was really important equipment for us in being able to do vaccinations and thinking about equity. It allowed people to register and us to provide access to vaccines based on prioritization for appointments for those that were most at risk. And then we were able to address barriers to vaccination. So we focused on making sure that people could get access. If they called the hotline, they could get help with registration. If they were homebound, we had homebound vaccination opportunities that occurred. We worked with essential businesses to make sure that essential workers had access to vaccinations, either at a clinic on site or at appointments that were convenient for their work site. And then once vaccinations were more readily available, again, we offered the walk-up. So we know that that's important in some of our communities to have walk-up availability. And so we were able to do that through, especially on the buses throughout the community, providing walk-up opportunities. And when towards the end of the year, when our rates started to go back up and capacity at hospitals was really being impacted and the hospitals were being overwhelmed, here we had the treatments were available for monoclonal antibodies for COVID-19. So the health department was able to offer monoclonal antibody treatment at the health department to help support and ensure access at our hospitals and provide access to monoclonal. So then our workforce, we had an average of 115 full-time staff with varying expertise. During the pandemic, we did need to surge staff still in 2021. We continue to surge staff both with our MRC and with others support. So for example, the Illinois National Guard, they provided assistance for the vaccination effort, which was really vital for us being able to have the community-based vaccination sites and to support vaccinations of at-risk populations. And then IDPH and IEMA, they help support with contract nurses to assist in the response as well. And so that was important. And we got to kickstart our virtual all staff meetings as well. We got to continue with those. So that's good. Quality improvement. So again, this just focused really on the Qualitrix system and how it connected us to individuals that registered through the system. So they were able to register through the system. Then we were able to quickly communicate with them. So as they needed appointments or as booster shots became available, or if they were immunocompromised and needed the third dose, this allowed us to quickly communicate back to them. The system also provided an easy to read dashboard that provided us information on what the vaccination status was here locally. So how many people were getting vaccinated, who was getting vaccinated, where they were getting vaccinated, at least as if they were getting vaccinated through WCHD. And so it also provided us information on how many vaccines we were administrating through our system through WCHD. Qualtrics also was an important tool, and then it allowed us to communicate then when the Rockton fire did occur, those that were in the impacted zip codes. It allowed us to offer them the opportunity to fill out the health impact survey, which then provided them an opportunity to provide information into what might have been potential health impacts from that. And it really showed that the virtual way of outreach did improve the number of people that responded to that type of survey from previous surveys. So that was a stronger results for the community. Evidence-based research. So again, just the Qualtrics, the health impact survey was important in that it provided information that 1 mile radius mitigated the potential health impacts. So that was really a big takeaway from this year. And best practices. I mean, there were just a lot of best practices that came out just with even the vaccine being effective and reliable. We saw changes that we had to kind of maintain and stay up to date on. So the quarantine and isolation guidance, you know, it was initially 14 days, but that changed throughout the response based on your vaccination status and testing availability, things like that. So, and then guidance again for booster shots, when you get a booster shot, if you get a booster shot, how many months, you know, you've seen that change even from 6 months to 5 months. So just staying on top of that, there's a lot of evidence-based practice that that then reflects in that guidance and those changes. So management, we just say we welcomed Charlotte as our Director of Public Health Policy to the team. We also, you know, continued to provide updates on the COVID-19 response to our partner agencies and elected officials. And we got to continue some routine work that had been postponed, got to slowly resume some of that. So our team that, you know, does Narcan trainings, they've got to provide more trainings and do them virtually as well. So there's a lot of activity happening. And then governance, we just had a lot of different elected officials that we were interacting with, whether Dr. Martell was keeping them up to date on what was happening with COVID-19 or the Kimtool fire and the potential health impacts, or whether they were, you know, coming to news conferences at, you know, the governor came to a news conference at one of our school-based vaccination sites. And when we opened the Sandy Hollow site, that was our mass vaccination, our community-based vaccination site, sorry, the director of the Illinois Emergency Management Agency was there to launch that along with other Illinois representatives. And then we had Congresswoman Bustos out at that site to tour that site, and she gave a media briefing from there as well. So there's a lot of governance in this past year as well. And then the rest of it is kind of just the data numbers, and you'll see, you know, some of the data is very similar to last year. A lot of things were impacted, you know, by COVID-19, but we just saw, you know, some of the same things. And then just some pictures about our staff and how the year went. And then pretty much our stuff there, and then the full data table in the back. I'll take a look at that. Are there any questions?
What will the distribution of this be, Katie?
Great. So yeah, so we'll put this up on the website and we'll send it out to all the partners that we pretty much send the liaison report to. We'll send this one and the 2021 out. So it has kind of to our elected officials, our partner agencies, and then it'll live on the website.
Will we get copies of this?
Yes, I'm sorry. And it should have been in your folder. I think I accidentally copied over this one with the monthly Board of Health report. So you might have gotten 2 of those and only 1 of these. And so I apologize for that. That was my.
Not a problem.
That's okay. So you will send them out, Katie?
Yes, I'm going to send both of
Thank
these.
That'd be good. But it looks good.
Yeah, nice summary, Catherine.
Mhm.
Yeah.
Okay, were there any other questions for Katie about the annual report? Otherwise, let's go on to Jim's COVID update. And I believe we've got a dashboard on page 33.
So this is our one-page summary. It is on page 33. And I guess we can very briefly go through this. The weekly case rate has really declined. This is the cumulative cases. Again, this is a graph we use all the time. I'm going to sort of pull your attention over to the right-hand graph, because this is really shows how big this recent peak was and how quickly it spiked up, and now it's just as quickly declining now. This is really pretty remarkable, and this is what all over the country they've seen this, basically this same peak and drop. We peaked around January 11th and 12th. And now it's declining. Since we're reporting on the January data, we were still at 5 times the rate from the CDC, which is to be in the high transmission rate. To get out of high transmission, you have to be below 100 cases per 100,000. As of today, we're down to 290. So these numbers have continued to drop as this line continued to drop as well. Our ICU capacity for the region, this is the chart on the lower right-hand of your packet. You can see that this has been extended since really July of last year, aside from when things really slowed down in the fall before this peak. Our ICUs have been below that 20% threshold capacity. And so that's been a real challenge for our area providers, not just in their ICUs, but in their overall hospital use because of COVID and COVID patients. We continue to see that the Hispanic Latino population's case rate is significantly higher than the case rate for the white non-Hispanic population. This chart that we give you, that we've shared with you every month, really looks at cases by age cohort and deaths by those same age cohorts. We do see there's definitely been an increase at the younger ages, but that's also, everything is now slowing down. But that was part of this latest surge as well. And I guess the only other thing that I have on here is that our in-house vaccination clinics that we've been running at the health department will be discontinued as of the end of this month. I don't know if you have any questions or if anyone else has anything else they want to add.
Any questions? Okay,
Thank you.
thanks. Thank you, Peter. Then let's go on to the Board of Health report for January.
This has been a month of reports, so we won't go over this one in depth, but we wanted to introduce the new format and our resumption of what was the monthly report to the Board of Health. And again, Peter will be presenting a little bit in quality. You'll notice now we are going down from 12 to 10, and it's really with the new alignment with the new accreditation guide standards. And we're also putting our data book and our statistical reports at the back of this. So you see the narrative reports. There might be some brief charts or graphs, but the majority of the data reports will be at the back, and that will help us roll up on the annual report as well. So this should be a compilation of activities. So this will give you an opportunity to ask questions. And so we didn't have a specific highlights. We'll start that next month per se, but we just kind of wanted to introduce you to the new format. If you have thoughts or ideas or how we can make it better, please let us know. And if you have any questions about if you had a chance to look through it and read through it, I know you got 2 of them this month.
Yes.
We wanted to reinforce it, it's the new and improved version. So many of, again, with the idea of what we're reporting based on the domains.
I like the format. I thought it was, it read well and all of that. Are there questions? No? Okay. Well, thank you. Yeah.
And as you go through month to month, if there are things you want to see included as we move forward, please let us know.
Mhm. Okay. Thank you. And thanks to the leadership team who all I know work together to put that information into a clear format like this. Okay, then the next item on our agenda is the president's report. And even though the president isn't exactly here, we have 2 things on there. One is we wanted to let everybody know that the county board chairman has been invited to join us for our April Board of Health meeting. And Sandra, do you want to say a little bit about that?
As we did in the past, we typically had the board chairman attend really one of our meetings. April is Public Health Month, so that was why April was selected, so he could get to meet all of you as the Board of Health members, talk about what some of his priorities are and how the public health and strategic plan and how we might align some of our activity with the Board of, the Board of Health with the Winnebago County Board. So it's an opportunity to do kind of a meet and greet as well as an overview of what his priorities are for the county and then how might public health fit into that.
Okay. And we're hoping that maybe we will be back in person for that meeting.
We're optimistic.
We really can do that.
That we're going to be back in person if the numbers continue on the trend downward. But again, kind of an opportunity as well for him to understand how our board functions. We do have some vacancies as well. So hopefully that will give him an opportunity to identify some individuals for our vacancies on the Board of Health.
We have more than one?
Right now you have physician, but we've got some terms that are coming up.
How about terms that came up a couple of years ago?
Those 2, Ron. They're all in the great meet and greet.
Yep. We're all in the post-COVID great beyond.
We're back on track, as they say.
That's right.
Do I have to electioneer to get back on, or am I going to get zapped?
You'll have to, I don't know, what kind of snacks are you going to bring for the meeting?
Yeah.
The Zoom meeting? Oh, all kinds of stuff.
No, it's an in-person.
It's an in-person.
I'll be Zooming then. From my favorite restaurant.
We're all going to have to take off our sweats, put on our regular clothes, and polish up.
Yeah, you're really depressing me now.
Oh. Well, I think personally that it would be very nice to see all of you in person. So,
Yes.
So with our sense of optimism, April will be kind of our recognition of Public Health Month. The chairman of Winnebago County Chairman will be attending our meeting, and our goal is to meet in person. So kind of keep that on your calendar dates.
we will. Okay, and we also have an update on the food establishment waivers of fees that we voted on. Oh my, I did not go back and check minutes to see when we voted to recommend to the county board that the fees be waived for this year, given the disadvantages that the food establishments have faced due to COVID and the opening and closing and masking and all of the saga that we have lived this past year and a half, 2 years almost. So, Sandra, did you want to speak to that at all, or?
Well, again, we are getting ready to permit, and again, we're sending out for, believe it or not, we send out now for the 2022-2023. So I'm going to pull up, and I'm going to screen share. It was in March that you adopted the resolution to propose the board to waive the fees. So.
And that was a recommendation to the county board, right?
Correct. So that was Board of Health. Everyone can see this. Resolution 2101. And again, the challenge that we have is whereas annual food and beverage are required for food establishments, provided Section 57, and its Board of Health recognizes the impact. And again, the idea was to provide pandemic relief with understanding that it would be support from the Winnebago County Board to recommend the approval of the waiver of the 2021 annual permit fees. The challenge that we have is that the county board has not waived the 2021 permit fees. And so we are, again, part of the discussion that we're dealing with is we really officially took out the fees without basically made the recommendation we did not charge them for 2020, 21, 2022. I know this gets, and then now we're going to 22, 23. So part of the discussion was, again, we are now going to be sending out invoicing them for the 2020. So again, there was some recommended verbiage that environmental had proposed to send out, kind of to remind the food establishments that it was through the Board of Health that those actions were taken. So I'm putting up what is some verbiage that was recommended that relates to the Board of Health. Thank you for your efforts to comply with the COVID-19 mitigations throughout the course of the pandemic. In recognition of the impact that the pandemic had on your establishment, the Winnebago County Board of Health, with support from the Public Health Administrator and myself, it's coming from Todd Marshall, proposed a waiver of the annual food and beverage permit fee for the 2021-2022 permit year to the Winnebago County Board for adoption as the authority on the ordinance. While the Winnebago County Board did not act on that proposal, Winnebago County Health Department, with full support from the Board of Health, did not invoice you for the permit fee. So now we are going to invoice them for the 22-2023 permit. So
one of the go out with those invoices, Sandra?
Correct.
Are there any questions?
Are we looking to increase fees this year?
Well, Dr. Halverson, again, that would be by ordinance and that would be by the Winnebago County Board. We are participating with the purchasing department that they're doing a review of fees. So we are put our fees into that review process as well.
All right, thank you.
Any other questions?
Pat, could I ask a procedural question?
Mm-hmm.
Why are we doing a roll call vote?
As part of the Open Meetings Act, when you are, again, because some people are on camera, some people off camera, if they're on phone, then we should do a roll call by name vote so that we're clear that that individual is casting their vote.
But Angie's been on the phone since we started.
Angie's been on a phone and a screen. And today it was, Jennifer was dialing in by phone is what we understood, Ron.
But Angie has been on a phone without a screen for a long time.
That's
Correct.
right, since it started.
Right.
Yeah. So,
I think we're playing catch up.
On the county board, we've been doing that right along. And I don't know why on the board we haven't, but it makes our meetings 3 times longer because many times you have to go person to person to person to find out their vote. So it's a matter of record.
right.
Where
Yep.
we're all together. Maybe Ms. Vaughn would like to talk about that.
Right, since this meeting is virtual, and to make sure everybody's vote is recorded, it is best to do a roll call vote. It does make the meeting longer, but it's just to make sure the record is accurate.
So what does that mean for the votes that were taken in the last 2 years
They still count.
that didn't comply?
They count.
Would you like to redo all those meetings, Ron?
No, I was thinking we just plow ahead and let somebody else complain about it later on.
Well, and the other part, we should be clear too, the minutes reflect your votes as well.
Mhm.
And so you review the minutes. So if the minutes do not reflect an accurate cast of your votes, we would want to make sure that you made that correction.
Sandra, Dr. Martell,
Yes.
Yes,
can you guys hear me? I'm not sure
Yes.
if you can hear me.
We can hear you, Jennifer.
Oh, okay. Dr. Martell, I missed something. My phone blacked out. Can you tell me maybe you already said it, what are those establishment fees? What is the cost that we're talking about for the food and beverage fees, permit fees?
it varies based on risk level.
Okay.
And then within the risk level, it's based on the size of the establishment, which really reflects meals served.
Okay. Thank you.
Okay. Any other questions? All right. Hearing none, we can move on to the committee reports. And I do not have any report from the executive committee. So we can move on to the finance committee.
Okay, for finance, we need approval of the minutes from February 9th, 2022.
So moved.
Second.
Second.
Aye.
Who said aye? Because we have to do roll call for all votes now.
A roll call vote. Ron Gottschalk.
Aye.
Aye. Angie Gorel.
I don't know what's happening.
We're
But
voting for the
all of a sudden,
finance committee minutes.
in and out.
Angie, we're voting on the finance committee. We're voting on the finance committee meeting minutes from February 9th. Do I have your vote?
I'm as I look at you, many of you, I see you talking, but I'm not getting it. Somehow or other, we're losing each other in the transmission tonight.
Perhaps.
And then
Pat, you're muted. Pat, you're muted.
Okay, can you hear me, Angie?
Pat, I can't hear you at all.
No, okay.
And I hear you fine.
Then
Yeah.
Maybe we want to give Angie the opportunity to abstain.
Or have her reconnect.
Right.
Yeah.
Maybe Christina could help her reconnect.
I think I voted along with you guys all the way.
Angie, can you hear anybody?
Angie, are you giving me your proxy? Is that what you're saying?
What I'm saying is, like, Ron, right now, you talking to me, you're breaking up. And Pat, sometimes when you talk to me, you're breaking up. It just depends. Even when Sandra was on, she was breaking up back and forth.
Why don't you reconnect? Hang up and reconnect.
Oh, that's a job. All right. It could be my phone then, is what you're saying. Okay.
Breaking up is hard to do.
Why don't we go on with the roll call?
I'm gonna reach out to her because I think she's
Because you're
using
hearing
both
me
of-
right now.
Yeah.
Yes.
Okay.
So I think she may
As
be.
long as you can hear me. Quit
Yes and
laughing,
no.
Miss Vaughn.
Dr. Halverson, can I get your vote?
I'm sorry? No, yes, you have my vote. Aye.
Wow, this is going to be a
Dr.
short
Helen?
meeting.
Dr. Helen, can I get your vote?
Aye.
Lucy Hoover,
Aye.
Dr. Lewis.
Aye.
James Powers.
Aye.
Dr. Williams.
Aye.
Robert McCreath. Alderman Torina. Jennifer Moraski.
Aye.
Thank you.
Jennifer,
Hello.
you're hearing us?
Pardon? Yes, I am.
Okay, good.
Okay. On to the financial statements for January of 2022. Jim?
Okay, I'll share my screen here. Okay. Okay, we'll start out with the resolution for expenditures.
What page?
Should be up on the screen. I have to screen share this. These were just produced today. Can you?
Oh, I see.
Everybody see that? Okay.
Can't wait for the vote.
All right, yeah, be it resolved for the expenditures for the Department of Public Health be paid for the month of January 31st, 2022, as indicated above, in the amount of $761,745.81. So do I have a motion to approve?
So moved.
Do I have a second?
Second.
Okay. Is there
Aye.
discussion or we'll just vote? Okay.
I'll take the roll
Christina,
call
I think
vote.
we need a roll
Yeah.
call again.
Ron Gottschalk.
Aye.
Angie Goro.
Aye.
Dr. Halverson.
Aye.
Dr. Helen.
Aye.
Lucy Hoover.
Aye.
Dr. Lewis.
Aye.
James Powers.
Aye.
Dr. Williams.
Aye.
Robert McCreath. Alderman Torina. Jennifer Moraski.
Aye.
Thank you.
Okay, we'll move on to the fund balance, which is essentially our ever-to-date or year-to-date performance. And so for January, about the middle of the page, January 31st, this month, we had 910,000 in revenues and disbursements of the 761, 745 and 81 cents. So year-to-date, we've had 3.719 $483.33 in revenues, disbursements of $3,682,270.17. So we started the year with $10,023,790.82 as a fund balance, and it has increased $37,213.16 for an ending balance of $10,061,003.98. So if there's no questions, I'll move on to our actual budget performance, because we're in the financial review portion where we are in the 4th month of the county fiscal year and the 7th month of the state of Illinois fiscal year for 2022. So our budgeted revenues were 3,626,561 with actual revenues of 3,718,585.45 with a favorable variance of $92,024. And our expenses budgeted were 3,593,149.33 with actual encumbered of 3,682,270.17 with a variance of 89,121. So we've been pretty close to plan. Now this is the balance sheet for the month of January with various cash accounts and receivables. Total assets of 13,422,000 roughly, and then liabilities of 3.3 million, 3,360,000, and a fund balance of the $10,061,003.98. So I'll move on then. Okay. And okay, this is the revenue and expenditures. I'm having some trouble here. Okay. By detail. Okay. All right. I'm having some issues with my PDF. I'm terribly sorry about that. Let me see if I can load the file up again. I apologize. It just seems like we're having that kind of a night. Okay. All right, here we are at the revenues and expenditures, which is by detail. So there were real estate taxes, and then food service permits, only 31,000 year to date. So I'm expecting quite a bit more. We actually are just starting to bill those as we've discussed earlier. And then actually the summary here is the down below. We have the 3.7 million in revenues and 3,682,000 in expenses. So we have a surplus for year to date of 36,315.28, and then for the month a surplus of 148,893.31. Okay. And here is our reserve minimum graph. And for January, we're in blue there. We're very close to where we were a year ago. So our cash collections are somewhat on target. And I'll move on to the receivables here list. And you'll see that we have in this column, the accounts receivable from our various grants of 1,850,683.87, which is rather large, but it's mostly the contact tracing, and then 2 months of our WIC program, and Also, we have quite a bit in our SOR naloxone program because we've been buying the Narcan spray. But we also have down here below is 740,000 in deferred revenue, which are deposits that we receive from these grantors that we have not yet earned. So as we go back to this other screen, I want to point out that that particular cash that we hold is not included in this number. So if at some point we had to send it back, there would be absolutely no impact on our final financial position. But this is our, right here, the second line here, where we've collected $1,347,400 in two separate payments, which we just received one in January. So we essentially owe them $615,000 in performance. And then this next line is our typical seasonal or annual local health protection grant deposit. And that we will certainly utilize the $124,000 left over. So we will certainly earn that portion in the months to come. So, so are there any questions on any of these? It's we are, I think, holding pretty steady. No real surprises. So if not, then I'll stop sharing. I apologize for the glitch. I guess there's just some electricity in the air tonight. So
Did you do the bank reconciliations?
yes, we had those at finance.
Okay, so that was the finance.
Yeah, committee. Yeah.
Okay, so we move on to our major expenditure requests. Items A through B were already voted on and moved by the approved to motion to advance by the committee. And item C, which was the Wilson Electric work for the elevator, was voted on by the board as a whole electronically on February 2nd, 2022. So we have a motion for items A and B coming from the committee. Do we still need a second? Okay, our attorney says no. Excellent. But we do have to have a vote.
Mm-hmm.
So we will call the roll for the vote to approve the IDPH electronic filing fee for death certificates and the CMM Environmental Home Accessibility Program.
Roll call vote, Ron Gottschalk.
Aye.
Angie Gorel,
Yes.
Dr. Halverson,
Aye.
Dr. Helen,
Aye.
Lucy Hoover,
Aye.
Dr. Lewis,
Aye.
James Power,
Aye.
Dr. Williams,
Aye.
Jennifer Moraski.
Aye.
Thank you.
Next that should be listed is proposed contracts and agreements. Again, the Finance Committee approved a motion to advance major expenditure item A, which is the Region 1 HIV prevention contracts. We need to bring to the vote to roll call.
Christina, you're muted.
Vote. We
Roll
have to-
call, Ron Gottschalk,
Aye.
Angie Gorel,
Aye.
Dr. Halverson,
Aye.
Dr. Helen,
Aye.
Lucy Hoover,
Aye.
Dr. Lewis,
Aye.
James Power,
Aye.
Dr. Williams,
Aye.
Jennifer Moraski.
Aye.
Thank you.
And we bringing updates from our lead contractors about reopening bid process due to material supply increase. As we discussed in the Finance Committee, due to COVID, and supply chain issues. This was not a unexpected request. Did you want to elaborate on it?
We brought it for informational purposes to the board so that you'll be seeing it come back through once we bid out. So these are typically the lead contractors with the windows, the doors, the siding, and all of that, those material costs. So they requested that we reopen that discussion on the material costs. So we were putting it through the purchasing agent of the county board, and then we will go out for bid, and we will then go through the process of that, setting those rates.
As well as the APP round 4 liabilities.
So we had, this was an update. We had brought 2 properties. We had concerns that the board may have to, when we looked at our reserves, may have to use related to whether or not they would be covered by the funding through the abandoned properties program through the Illinois Housing Development Authority. So good news on one front, one of the owners has decided to take down, the successor owner of the property has decided to take down the property of their own expense. So then that will not. And then the second one was the multi-structure property. And we've been able to kind of revisit that and work through an agreement so that we're able to take down a much smaller portion of that property and in terms of what we're planning to do. And so that liability is much reduced. It's about $6,000 was kind of the estimate that Todd was provided with most recently. We're working through with that homeowner. Remember, this was a property that had multiple structures, a garage, 2 homes. And so we are talking about taking down the second home that is not occupied and working through that process. So that liability will be significantly reduced as well.
Excellent. Any questions from anyone on the board? Otherwise, that is the Finance Committee.
Thank you. And we can move on then to policy. And I think no meetings, Ron, nothing?
Nope.
Okay. Personnel Committee, Lucy?
No meeting, nothing.
Okay. And then moving on to quality. The Quality Committee had its first meeting in quite a while tonight, and reviewed some information about the FAB accreditation. And Peter's going to just do a quick summary of some of the new information about FAB accreditation as we come back to reaccreditation process.
Thank you very much. I'll do this very briefly. You have in your packet what we had submitted to the FAB as our section 1 for our annual report. Just sort of as a little quick overview, we were originally accredited by FAB in 2017. Every year, part of our compliance activity is to submit an annual report. It's a 2-part report. We just completed submissions of our year 4 reports for 2021. You have section 1. Last week, we submitted the second section. They describe the kinds of activities that we've been doing, challenges we may have faced, and things that we've been doing around performance management, quality improvement, in terms of compliance with the standards. We are up for reaccreditation to submit by the end of this year in 2022. That process the application process will open in the 4th quarter. By the end of the year, we're to submit our application, and then we follow up with all the documentation. And I guess what I'd like to just sort of what we'll be doing is FAB is in the process of updating their standards for reaccreditation. And so we'll need to just determine whether we're using the new standards or the existing standards. They're largely the same, but the new standards have a much greater emphasis around health equity and disparities and how the organization addresses those issues throughout the domains. Structurally, the new standards align very closely with the 10 essential public health services. So they sort of match up with that wheel that Katie shared as part of our new board report format. So each of those slices of that pie are the domains, but with a real focus on equity. So over the course of the next couple months, we'll be working really closely with the quality committee and sort of identify the approach, develop checklists, take stock of what resources we have, things that are already available, what documentation we need. We use our strategic work group, the Reaccreditation work group that Rebecca chairs, that will really help with document collection to help support our submission. And so we'll be working closely with the quality committee and then bringing some items to the full board as appropriate so that folks are aware of the process. It will be a year-long process that we'll be in as we go through this. Any questions? Okay, thank you very much.
This may be new. I mean, this is clearly new for Jennifer. The rest of us have been on the board long enough to have lived through this before. And so we do have an idea of the routine and the submission, and then the actual visit that we had before, which was quite an extensive look at all of the things in our report. And I think that you were saying during our meeting that we weren't sure that the visit this time would be as extensive, or whether it would even be in person.
That's correct. In light of COVID, the Public Health Accreditation Board has made changes. They're doing more things remotely, doing more things virtually. They've also indicated that when they do come on site or as part of the evaluation process, they're going to break it out into chunks over the course of multiple days. It sounds like they want to not do more than 4 hours a day so that it gives more flexibility for staff and folks to be able to meet with the reviewers and not necessarily, I guess the last time people sort of had to be available for full days and it was difficult to coordinate some of that. So it sounds like feedback that FAB has received from health departments over the last couple of years is informing them to improve their process a little bit and to try to streamline it and make it a little bit less cumbersome or onerous on the health department as they go through that. So we'll have a lot more information about that as we go forward.
Okay, thank you.
Thank you.
Any other questions, or does anyone want to add anything to that? Okay, otherwise the quality committee then is complete. Is there any other new business, Sandra? Nope, we just know that we do need an executive session.
Correct.
Mm-hmm. Okay. If there's no new business, then let's move on to the executive session. I do not have the statement about. Who said that one?
We can put it up.
I'm going to put it up. Just give me 1 second.
Oh, okay. Thanks, Christina. Yeah. If we're having trouble, Lafa, would it be okay if we just stipulate the statement that we all know and put that into the minutes?
You at least have to state the reason. I'm not even sure why we're going into
It's for matters of personnel.
Right.
Okay, so section 2C1.
Mm-hmm. Okay. Can you get that just into the minutes then, Christina? Okay.
Say yes.
I'll get it into minutes.
Okay, thank you. So we're going into, we need
I move we go into executive session per the appropriate state statute for personnel reasons.
I second.
Second.
Okay, and then we're going to need a roll call.
Oh, that's unusual.
Do I end the stream before the roll call or after?
We need a roll call to go into executive session, and then we will need one to come out.
Correct.
Okay, Ron Gottschalk,
Aye.
Angie Gorel,
Aye.
Dr. Halverson,
Here.
Dr. Helen,
Here.
Lucy Hoover,
Aye.
Dr. Lewis,
Aye.
James Power,
Aye.
Dr. Williams,
Aye.
and Jennifer Moraski.
Aye.
Thank you.
Did we need a minute for staff to sign off?
Right.
Okay, and how can we get you back, Christina?
I'm going to